Um, Today's keynote speaker, Bill Kadereit, has been the president of the National Retiree Legislative Network since January 2008. He also serves as chairman and president of the American Retirees Education Foundation, the research and education arm of the NRLN. A former director of the Lucent Retirees Organization, he retired from AT&T Network Systems, now Nokia, in 1995 with 35 years of service. Bill reminds us too that Bill and us Chrysler retirees have a lot in common, as his company changed identities from AT&T to Lucent Technology to Alcatel and now Nokia. Very, very similar parallel path as we go through with Chrysler. He subsequently served as a senior vice president of a large US corporation and president and CEO of 3 technology-based startup businesses. He is a graduate of the University of Nebraska, the Stanford University Sloan Fellowship Program, and a Brookings Institute Fellow for Government and International Business. He has served on the boards of a bank, hospital, and university advisory board. Bill and his wife Rose currently live in Heath, Texas, about 30 miles east of Dallas. Please welcome this morning's keynote speaker, NRLN President Bill Kadereit.
Thank you, Mike. Thank you, Mike. Hey, that was a big step up in the world. Jay, I had a similar situation. My daughter, I was telling Deb, it's been 3 or 4 years ago, sold a car and left the plates on the car. And a year and a half later, she got a notice from the county, Rockwall County, Texas Sheriff's Department that she owed $3,000 in impounding fees. They'd never transferred ownership of the car. It's amazing how that can happen. And she talked her way out of it, though. I wanted to talk just a minute about NCRO, if I could. NCRO has been an anchor for us, and Jay is the director of our Income Security Committee, has done a tremendous job. Deb has been the legislative person who studies all the bills that are released by Congress. And through the reorganization of those bills, she studies them, then she feeds them to our committee that then decides what we're going to lobby, where we're going to place our bets, and who we're going to see. So NCRO plays a vital role in the ongoing business of the NRLN. We appreciate their leadership very much. I don't know how much you know about the NRLN. We're a nationwide umbrella organization that was founded in 2003. And it's formed largely by corporations after they've gone through some troubles. Like you have GM, Delphi. We formed the Delphi organization, and that was a terrible situation that happened there. We have IBM, AT&T. We have Prudential Insurance of all companies. We have state agencies across the country. And we have about we now have people in 76% of the congressional districts across the United States, and our members live in all 50 states. So we've grown considerably in size and scale, but we have the same problem all other retiree organizations have, and that is there's a great deal of attrition every month. And so as Jay mentioned, we'd be appreciative of any kind of contribution you might want to make. Interesting thing happened to me. I was thinking about the other day about the battery-operated cars, and the trouble that's going on with Tesla and so forth. AI, what's happened post-COVID with all the technology advancements, and sitting on the airplane. And we're getting ready to leave Dallas yesterday. And as the plane took off and reached about 3,000 feet, the pilot came on. And he said, folks, we're on our way to Dallas, we're flying in such and such a vehicle, it'll take you 2 hours and 45 minutes to get there. And I hope you have a nice trip. I'm working from home. Okay, with that, I'd like to move into the first slide, and here's my button. Okay, that's easier to ask you. I don't know if you're familiar with de-risking. If you are, I'll have a little patience with me. There are two areas of concern here. There are two kinds of ways a pension plan can go belly up. And one is it is stress termination, and that's what happened to Delphi. That's where the corporation files for Chapter 11 protection to reorganize and refinance, and sometimes go down to Chapter 4, which is outright dissolving the corporation. In cases like that, the PBGC steps in and picks up the pension plan, and people are afforded the benefits of the service of PBGC, but it's prorated. Many people know this. Delphi people got slaughtered. They lost 30 to 40% of their pensions because they were younger retirees. They were not retirees, actually. They were between age 55 and 65, most of them. And so they take a steep discount from the, first of all, transferring from their own pension plan accruals to PBGC's benefits, but also PBGC discounts heavily for every year that you retire or the plan is terminated when you're under age 65. So they really lost a great deal. The other type of termination is called a standard termination. And that's where the word de-risking comes from. De-risking actually began in the 80s and 90s with the discontinuance of COLA. You remember cost of living adjustments? Any of you? They're no more. And then 401ks, of course, they are a defined plan, although they're a defined contribution plan, not a defined benefit plan. Defined benefit plan is what you and I have, where your age and service is compounded and you get so much credit for that against an average salary over the last 5 years or 3 years. That's a defined benefit plan. Defined contribution plans like the 401k, but they're still protected by ERISA. Cash balance plans, lump sum buyouts, risk-adjusted allocations of plan assets. What that means is companies began seriously getting out of more speculative investments and into more conservative investments like bonds and other such instruments. And so that was the initial formation of what de-risking meant. But it was really not de-risking back then. It was just called lump sum buyouts and so forth. But expanded now. The pension risk transfers, they are partial terminations for most of them. For example, you've gone through one. I believe people with $1,000 or $2,000 of pension were told they had to take an annuity. And that's the heart of the situation that we're working on, and that is, how do you protect annuities going forward? Well, when you're stripped of when you get an annuity, you no longer have pension benefit rights in terms of ERISA protections, and you no longer get the protection, therefore, of PBGC's pensions substitution of yours. And as Jay mentioned, you're at the risk of $250,000 to maybe $500,000 in some states, lifetime. So if your pension is $50,000 at the end of 5 years, you're broke. You got no income. And so what we set out to do was create a reinsurance proposal. And I wanted to show you a profile, first of all, of the member. That's right. Yes, here we go. In 2012, I conducted a study and asked all of the organizations in the AT&T and the NRLN, including AT&T, as you can see, and Verizon and others, to send in their annual funding notices, and we would make a study of what was going on with regard to the protection and security of plans. At that time, there were 2.3 million participants in the plans. Now again in 2022, we made the same study. You're in 2022, covering the 10-year period of time to see what happened. That 2.3 million participants is eroded to 1.9 million. But the fair market value of assets has actually gone up for that same group of plans. And the reason for that is market growth. Equity increases in the marketplace. But you'll see the liabilities were $239 million, and the plans actually today are funded in the 90% category.
But if you
look up
this
if you look up the
chart,
you see General Motors,
you can see
there
there
are zeros there, and that's because they don't have a plan.
If you look
at Verizon had a partial risk transfer in 2012, and they've just announced a complete standard termination. IBM down at the bottom, they announced an effect of 100,000 retirees. They annuitized 100,000 retirees, and it was $16.2 billion in assets. AT&T did the same with 96,000.
So this is getting
to be a very serious problem, and we've created a reinsurance proposal that Jay referred to and proposed it to Congress to the various committees.
The
next slide shows what's happened in the last couple of months actually, that AT&T's standardized terminations resulted in two suits. And we don't know whether these legal suits are going to hold up in court or not. I kind of doubt it's going to be very difficult to show anybody lost any money because they've yet to lose their annuities. But down the road, the issue is that there are so many insurance companies coming in, and so much money being put into these insurance companies to back up the annuities, that at some point in time we could have run into another situation like we had in 2006, if you remember that, when the financial industries crashed and we had the recession. The banks didn't hold up very well, and the insurance companies didn't hold up very well. So we're afraid that there's no backup there because PBGC is gone, and we didn't want to have some reinsurance protection. And so that's the proposal that we've made to Congress.
The Verizon
annuity termination I talked about. Kodak is in an interesting situation. 2 months ago, Kodak announced to the investment committees that they were thinking of doing a standard termination and keeping the $1.2 billion in surplus in the plan, which meant that all retirees, all people would lose their pensions, they'd be annuitized, but under the current law, the company is allowed to keep the surpluses. In this case, it was $1.2 billion. There's a penalty. And the penalty is 50% if you take it all and you use it for corporate purposes. It's 25% if you use it for other benefits that you can grant to retirees. And it's 20% if you start a new pension plan. So literally what they're considering is starting a new pension plan. And they didn't admit to that, but then when they submitted their 2023 AFN, which we just looked at, it says very clearly in that they established a master trust and put the funds for the pension plan in a master trust, and you just don't do that because a master trust is usually only put together when you have two or more plans that can manage the assets from one plan in one lump sum. So, going next to what we're doing, what are we doing about that? What's happened? Well, if you look at PRTs and standard distress terminations and standard terminations, plan combinations, Medicare privatization and re-engineering, and that means that, as Congress is doing right now, they're looking at taking back benefits, extending the lifetime eligibility and so forth. All of these things converge on Social Security re-engineering, and out-of-control healthcare costs, which affect savings and affect your ability to buy things. And the savings shortfall problem is huge. Less than 50% of this people eligible for retirement have more than $50,000 saved today, which is not very much money. It's creating what we think is coming as a tsunami of problems. Well, maybe not us, but certainly our children, our grandchildren, our great-grandchildren. If you just add 30 years to the age of anybody you know in your family, they're going to walk right into this because if things go as they are, there won't be a Medicare, there won't be Social Security, and there'll only be out of your own pocket.
which is a
dangerous situation, and it's very feasible it could happen because members of Congress want this to happen. They want to see privatization of Medicare, privatization of Social Security,
because then they
can wash their hands of it. It's no longer on the books.
And so when
you or I might ask them, well, what are you doing about my Social Security and Medicare? They can say, it's not our problem anymore. It's not a public program. It belongs to the private industry that is now driving up the premiums and the out-of-pocket costs for it.
So
let's go to the next piece here, and this is the list of 8 specific items that we have proposed in for reinsurance. And I won't go through all of them with you in great detail, but basically what it says is that if you're going to annuitize a pension plan, you must buy reinsurance equivalent to the value of the pensions and guarantee that for the life of the individual whose annuities have been issued. Second, and an option to that, Congress is considering that, you have to have PBGC underwrite. And PBGC would underwrite 100% and not their discounted standards, but 100% of your entire pension, your entire annuity. So where is that? Well, that's in the Senate Committee, Senate Finance Committee, Senate Health Committees, Senate Health Committee in particular. That's health, education, labor, and pensions. We can expect that that'll get consideration later this year when a new bill, as we refer to as a vehicle, comes along. And then we can look forward, I think, to probably this year, but maybe next year. Some of these things take more than 2 or 3 years to get through, get executed. We'll get that done. We did get a pleasant surprise also. We have other proposals, other issues like combining of pension plans. I didn't know if you knew this, but if one company merges with another company and a plan of funded at 71%, the other plan's funded at 91%. They put them together, and you have a plan at 83%, still inadequately funded. But the people who are better funded lose 8%. And what we're proposing is that can't happen. You have to fund up the plan so that nobody loses anything prior from where they were prior to the merger. Okay. Social Security recoupment and overpayments. As Jay mentioned, we had a recoupment bill under the Secure Act. We had a pension recoupment bill approved and put into place by Congress. We proposed the same ingredients for what is now the problem with regard to Social Security recoupment. People are overpaid. You can see here that there's a lot of money involved, and what happened is that the commissioner of Social Security came out. They've adopted some of our remedies. For example, they can't take out more than 10% a month. They can't take it out. They have to take it out over 60 months instead of 36 months. And this is because Social Security Administration made a calculation error. They overpaid people, and sometimes for 10 years, and they wanted it all back in a lump sum. And that happened the same way with the pension accruals. So we're proposing the same rules, and a lot of it's been already taken care of. So let's move on to healthcare now. We support Medicare Advantage plans. We support competition in the marketplace. But we don't support an uneven playing field. And Medicare spending was $1 trillion, and it's growing at 7.5%. $1.9 trillion by 2032. MedPAC, which is the Medicare Policy Pricing Committee, that is Congress's watchdog, has told Congress that Medicare spends
an estimated
22% more for Medicare Advantage and per Medicare Advantage enrollee
than they would
spend
if they were looking
at the same benefits for fee-for-service.
The
difference between
that
means that we're paying Medicare Advantage insurance companies
a total of
$83 billion this year to subsidize their plans.
And so when you
see the commercials, and Joe Willie Namath commercials, it's free. Everything is free.
It's not
free because whether you know it or not, 76% of every dollar spent by Medicare on Medicare B, physician services, and D, prescription drugs, comes out of general revenue. Out of the income taxes we pay weekly, monthly, quarterly, annually. It comes out of your income taxes, not payroll taxes and not premiums, but directly out of what we pay federal income. So what happens here is Congress is saying that Medicare A is failing, and we have to do something about it. But that's not the big problem. The big problem is Medicare B and D. That's where the big money is.
And they know
it because they can spend federal tax revenue of $84 billion to subsidize these plans. They do that because they don't want Medicare on the books. They don't want to have that as a burden. Each year you'll hear them talk about, maybe you hear the percent of the Medicare spending as a percent of GDP went up 1.2%. Well,
you say,
so what? What caused it? What caused it is not Medicare. Caused the number of people going up. But the number of people going up, they knew for 30 years. And so what they're trying to do is subsidize private insurance to take over Medicare. And this year so far, the payments made to Medicare Advantage plans amount to 17% of the payments made to Medicare Advantage plans are coming from subsidies, which means it covers all their overhead, all their profit, and a lot of cash flow. So what's happened is that Medicare Advantage plans have taken over and have now a 52% market share and 33 million customers. But there are 27 million other customers who don't get these rebates. So if you have, how many in your room have a Medicare plan, supplementary plan? Okay, and how many of you in the room are over age 75?
Yeah, that's quite, I'd say half at least. Let me show you a chart. Can you see these numbers? If you look at the blue line, you see the 80% over on the right, and you look at that. You look at that blue line over there, all the way up to the light line, and you see the 85% on the outside. That's 85% of the benefits paid by Medicare to people over age 65 on Medicare in fee for service. On the left side, you'll see the same colors in that stack on up represent 25%. And what that chart is saying is that 25% of the people in Medicare over age 65 are paid 85% of the money. And what that meant is that when in 2018, Congress authorized a bill that said, let's pay chronic payments to Medicare Advantage plans. They authorized the payment of this $84 billion to go to people who had chronic payments, who had chronic problems. But the people that are signing up for Medicare Advantage plans far and above are far younger than that. Most of them are in their early 60s. And as a result of that, the people who have the chronic problems are not getting the payments. And that's anybody with a Medigap plan. If you have a Medicare supplementary plan, you're not getting any of that $83 billion, but it's coming out of your taxes. That's not a good deal. What it amounts to is $2,400 per person per year. And so when Medicare Advantage plans buy a prescription drug plan and they pay $34, $35 a month, and they pay $4 or $5 for generic copays, and they pay vision care or dental care, those policies are relatively cheap. They may spend $180. They keep the other $30 for profit and overhead. And so all of those extra benefits are going to those who are younger, and those who are older who have the chronic needs are not getting them. And that's what we're after now is we're beginning to lobby to get Medicare to rectify that by including the funding of those benefits for everybody who are in plan or A and B. And if they don't do that, they'll have to cut back on the rebates. And we're insisting that they grandfather anybody in the Medicare Advantage plan that is currently receiving the same benefits. This is such a very critical matter because going unattended, it's going to lead to a significant increase in the total cost of Medicare. What people don't realize, what they don't realize even, is that those people have been going into Medicare Advantage plans, by and large, are a younger set, and they receive, therefore, they're consuming less benefits, less money. And over here is the other group that's consuming more money, and they're older. But Medicare Advantage plans have been around long enough now where the entire demographic is shifting up the scale. And that's why you probably read in December that Humana and other Medicare Advantage companies said, we might have to start raising premiums because of the activity level in Medicare Advantage plans. Well, that's a code for we're paying more. We have to pay out more benefits. So they're going to get crunched, and what's going to happen is the out-of-pocket maxes are going to go up. They're going to start charging premiums. This is me talking. You won't get them to admit it, but they're going to start charging premiums that they never had to charge before because they're not going to lose the revenue. They're going to protect their shareholders. The net profit margin of Medicare Advantage sales has doubled for insurance companies. United Healthcare's profit has gone through the roof by billions. Humana the same way. And all of that basically proves from the very beginning, which was our premise to begin with 8 or 9 years ago, you can't just take a public entity like Medicare, whose total payments for overhead, there's no profit, right? Total payments for overhead run about 2.5%. And tell me that a private firm with a 14 to 15% requirement for gross and net profit is going to, and they're all buying from the same suppliers, doctors, hospitals. You aren't going to tell me that the guy that's got the lowest overhead is not going to be able to whip the other guy's butt. And that's exactly what's happened. It's exactly what's happened. So my admonition is that we should proceed cautiously, but make no mistake about it. We're very concerned about the future, not only the cost of healthcare for Medicare Advantage people, plan people, but for everybody, because it's going to eat away at the purchasing power of everybody in this country. And sooner or later, there are going to be, we'll move one more if we can. This is a chart. It's an eye chart, so to speak. Let's put it, the bottom line says there's $483 billion see where the yeses are? Second column from the right. All right, that's everybody in Medicare Advantage getting $469 billion. On the right-hand column, the farthest right column, that's everybody else. That's the 27 million people. If you go to Medigap plan, that's where you're at. And you're not getting a nickel of it. And so what happens over time then is that all that money, that $468 billion, the spread between the cumulative cost increase for Medicare Advantage plans over the last 6 years has been 22%. For fee for service, which everybody says is no good, right? Fee for service, it's been 8%. In other words, 13% lower cumulative cost over 6 years for fee for service versus Medicare Advantage. Where's all the savings? Why is the government doing this if they're not doing it just to privatize the plans? And that I think is the ultimate answer. So let's go to the next. So this is maybe a better way to say it all. On the right, 53% are getting all the rebates, $84 billion this year. And on the left, 27 million people, 47% of the population aren't getting a nickel of it. And we're all the same. We all have Medicare A and B. It's just that when you have a Medicare Advantage plan, you have an out-of-pocket max. And the best thing I can say about that is that the way to look at that is if you divide your out-of-pocket max by 12, and I think the average out-of-pocket max across the country, not corporate plans, some corporate plans are cheaper than that, but I think the out-of-pocket max average across the country now is $3,600. That's $300 a month. You can buy a Medigap plan for that. The problem is you're going to pay the $300 a month every month, $3,600 every year, and if you're healthy, why spend it? I'd have a Medicare Advantage plan myself if I couldn't afford a Medigap plan. It's a good deal. But just remember, everything isn't what it seems. It's a good deal until the out-of-pocket max comes up to the point where it's not a good deal. My wife was sick for quite some time. She got bills, $17,000 a month would have been my out-of-pocket equivalent if I hadn't had a Medigap plan. And that was going to be forever. So forever, I was going to be in the hole, but against the Medicare Advantage plan. And the dynamics are changing so rapidly. I don't know how to advise people clearly, but I do know that if the price of Medicare is going up at 2.5 times the number of people going into Medicare, there's a big problem. And that's exactly what happens. The cost or the spending per enrollee is increasing at 2.5 times the number of enrollees going into Medicare. That says healthcare costs are grossly out of control in our country, and nobody knows what to do about it. How many of you have driven by dialysis centers in shopping centers, other specialty places, the places where they do the CT scans, right? There's one in every so many shopping centers. How many urgent care centers have you seen? How many CVS stores are now seeing patients? How many Kroger stores are now in that business and prescription drugs? What that's taking on is all the overhead of those companies, all the overhead and profit of that company. I'm not against overhead and profit, don't get me wrong, but by comparison it with Medicare with a 3% overhead, and that's it. I mean, that's amazing. People don't realize that for all of its warts, for the fraud and for all of the other problems, and they have big problems. It's like 3% of total spending. And I don't see any other way this heading in the wrong direction for people. And it is not something you can do by whether you pick a Medicare Advantage plan or pick a Medigap plan. It has something to do with getting these getting these people out of Congress that don't really care about you. They care about their next election. Because I have seen it. I've been there 20 years, and I got to tell you, it's bad. It's bad. When the Republicans are attacking the Democrats and calling them into hearings, and you went hunting and you shot a dove, we're going to kick you out of Congress. And then the Democrats they're firing at each other when they should be working on the problems. They should. I'll tell you what this data that I have here, you get a copy of it. Every single data point comes out of the Medicare trustees report or the MedPAC report to Congress. Every single bit of it. Nothing fancy about that. The Medicare trustees report is signed by the Secretary of HHS, Health and Human Services, Secretary of the Treasurer, the Secretary of the Department of Labor, and is sent to Congress every year in March. That's where these numbers come from. The MedPAC report is sent to Congress every March, and then in June, they make a special report to the Commerce Committees on both the House and the Senate. And they don't say boo about it. They all know that they're running these deficits, but none of them want to stand up and say, let's raise the payroll tax by 1.5% on people and companies, that's 3%. And in about 5 or 6 years, maybe 10 years, we can fund that for 75 years. And we'll adjust back then. Why? Because they have an election coming next year, not 75 years from now. And so our relationship and our policies in the nation relative to this whole matter of Social Security and Medicare is horrendous. And I'm a middle of the road Republican. I'm not a Democrat. I'm not a liberal. But I got to tell you, the liberal guys have got it more right than the conservative guys these days. And that's very, very hard for me to say. Very, very hard for me to say. But they're tearing down something they're going to need later. So, but
as you can see, he's totally into it.
sorry.
It's emotional stuff.
Well, yeah, it is. It's not good. Thank you. Oops. We were talking last night at dinner, and they said, "What the hell's the guy who turned 85 in August?"
Do you know he's going to be 85 in August?
So I commented. I said, "My wife is just coming out of a nursing home. She'll be out the 25th. She went through quite a bit. So I said, look, she's not stable enough yet. She can't walk. She can't. You got to give her more time." So I said, "I'll pay. I'm going to keep her another month. How much does it cost? Nursing home, $10,700. And that's not uncommon. Long-term care. If you don't have a long-term care policy, wow, don't get a serious chronic disease, because that $10,700 is every month. The average payment across this country right now for long-term care is $125,000 a year. And in most cases, all you're getting is people feed you medicine, take care of your personal needs, and you're not even capable of any rehab. It's almost like I've walked down the aisle of this place now for 5 months, and it's like you've got people over here who are not going to be able to rehab. They're going to be long-term care until something more serious happens. You've got other people that are in hospice, and you got people that have just been released because they had knee surgery and they're going to get rehab for 30 days. But the rate that what they have to charge, and I can see it. I can see it. The traveling physicians come in, and they come in the room just like they do in a big hospital. I mean, yeah, how are you doing? Yeah, $100. You know, take your temperature, $100. I don't know if it's necessary. I think there's too much bricks and mortar. I think there's too much overhead. I think there's a way to do this on a nonprofit basis that is not a liberal kind of thing to say, but it's a necessity. And I hate socialized medicine. I do not believe, and I don't think you would, that we ought to tell the government you should own the hospitals, you should own the clinics, you should own. I believe in capitalization. I believe in the enterprise, but I don't believe there's incentives in the profit world, in the P&L world. There's no incentive for dealing with the inefficiency in healthcare, because you may need that dialysis center within 8 blocks of where you have to get people to, but it's too damned expensive to have. So somehow we have to have the right solution. And what I think you need to do is support the NRLN and support the NCRO to get that point across to people. So I'll be glad to take any questions.
I'm like Lincoln, I can talk loud enough. I'm glad Bill was here because I often talk to you about our relationships and what we try to do for you guys as not only FCA, not only as a part of Chrysler FCA, but as a part of humanity and as a part of the other parts of the other parts of the benefits and things that affect you. And hopefully you can see from Bill the dedication that he has had, and that's why we're happy to be associated with the NRLN, because they help us help you affect the things that have nothing to do with FCA, but things that are hugely important to you and your family. So, Bill, I just appreciate what you do.
Thank you. I will close. I want to comment on something that's I think pretty important here. People often ask, well, why should I be concerned about the NRLN? What do you really bring to the table? Well, I think the biggest thing to bring to the table is we're your voice in Washington. Whether you are FCA, whether you're NCRO or AT&T or IBM or Alcatel or Prudential or Johns Manville or a telephone company, lots of telephone company people, it doesn't make any difference, because our proposals are driven to income security only and healthcare only, and only for retirees. And we also are cognizant of prospective retirees. It's not just us, it's what we can do to make things better, to create a little better life for retirees. Thank you.
If you have any questions, if you don't, thanks for coming.